1 second. Can you see this?
Yes, I can. Yeah. You just click the present button on Figma.
Huh? Okay. Oh, yeah, yeah. Wait. No, wrong one. There.
There you go. Nice. Okay. Triage AI. Huh? All right. Please get
Yeah,
started.
that's the name of my project. Okay. So my project's name is Triage AI. This is an app I made in the medical field.
Interesting.
So it has mainly two purposes. For the patient, it provides a simple translation where it can like translate what the patient says. For the doctor, it allows a detailed analysis of what the patient says. That analysis has a couple of things, but mainly it's like how serious is it and like a couple other things.
Okay.
So here's the main issue I'm trying to fix. Uh, like across the globe, one of the biggest issues to in medical is this language barrier, where the doctors are not able to understand their patients. This is because like the doctors need to understand what the patients are saying, and like when they're talking a different language, they cannot like understand each other, and if they're not able to understand each other, doctors will have trouble pinpointing the exact issue. That can cause huge delays or even make it really difficult or impossible to figure out what the issue is.
Hmm.
And this is like a huge issue. Like in the US alone, over 25 million people yearly face this issue of the language barrier, where the patient cannot properly speak to the doctor. Either they cannot share any language at all, or it's like their second or third language and they speak it really poorly. All of that factor into a lot of delays and problems with helping the doctor understand the patient's issue. Wait, no. Yeah. Oh, you can't see the image here?
I cannot see the image. I'm sorry. No, it's fine. Like I think the solution slide, right? It's basically a demonstration only, right? So why don't
Yeah.
you just explain the solution through the demonstration?
So my solution has my solution is an AI powered app, and it has like two main parts.
Aryan, just start the demonstration and explain
Oh,
the solution while you're doing the demonstration, right?
sure. Let me get my okay, can you see this?
No, I cannot. Are you sharing the screen? Oh, there you
Yeah.
go.
Okay, you
Now,
can see
now I
this,
can.
right?
Now I can see it. Now I can see it.
So this is my app, Triage AI. This is mainly the launch page where it will like give the basically like details, like you can read through it.
What is this page called usually?
Just the like the launching page.
Well, this is actually called the landing page, not the launching
Yeah,
page.
sorry, that's what I meant.
Yeah,
Yeah.
because people land here, right? This is the first thing they say. All right.
Yeah. So this is
Nice.
basically the main page, and then
Cool.
you can open it here, or at the top. I'm just gonna open it here, and this is the main part of my app. So here is the first main part, the input slide. Uh, so this is just the AI model. You can ignore that part. Here are you can input your drug allergies here, your medications here, your like blood pressure, blood pressure, heart rate, oxygen level, temperature, and like your main symptoms. These here is just like for if a person like has doesn't like know any language or any language that I've put here, then they can basically look at these images and use that to give detail to like what they're feeling. The interesting thing I have here is I can have it change language. It will change everything here. Like as you can see here, parameters vitalis. I can change it to French, Hindi, and Chinese,
Interesting.
and that'll turn everything into that language. So now, just for the analysis, let's say I'm going to say my chest has been hurting for 3 days.
Pause for a second, Aryan. Actually, okay. Can you? Does the voice feature work? The voice input?
Yes, I was going to get to that, but I guess I can show you. So
Okay.
you
If,
can
no, if
all,
you're gonna get to that, get to it when you will. Okay. No, don't rush because of me.
okay.
All right.
So here are the main analysis features it shows here. Uh, so it also puts us into this list. If you see here, like there's a queue. So if you start putting more symptoms here, the queue is gonna like start to fill up, and it'll like like list down. And this is the like how the severity basically, where one is the most severe. So right now, I haven't given it much information, so it's saying with 75% confidence. I can like make it more sure. Let's say I have an abnormal amount of temperature, like 109. Uh, like
Mhm.
yeah, okay, sorry, I thought it wasn't working. Yeah, so it's gonna show now that it's like really high. It's still gonna say like 75% confidence, but like now it's able to pinpoint that this is like a red flag here. The 200%, the 200 BPM, it's able to see that it is extreme unstable tachycardia. And now like we can see all the analysis features here, right? So this is just gonna repeat what was said here. This is gonna like show some clinical keywords. Same here, like that it's showing chest pain, also showing cardiac pressure. This is going to show which part of the body it seems to be in, the cardiopulmonary system. Uh, then there's the pain assessment, which is going to show like moderate because it's just saying my chest has been hurting. Let's say,
Hmm.
I think it'd be more accurate to say like my head is hurting, but if it's like really high, yeah, there we go. Now it like makes sense because it says my head is hurting and really high BPM. Those match together, so it's gonna show a really critical level.
Got
And
it. Once again, what does clinical rationale mean? You see at the bottom it says calculate safety via strict local boundaries. What
yeah,
does this mean exactly?
so this I put here to be like the average amount. This was like supposed to be. Well, actually, let me just clear that for a second. Okay, wait. So like over here, this is the average amount. Okay, 75 BPM average, 120, 98, 98.6. This is how much the average should be.
All right. So it's the rationale behind the decision of flagging it as
Yeah,
moderate pain. It's like, what is it? Tachycardia or
yeah.
whatever that was.
So when I show the heart rate as 200, it immediately put this as 200, and it was able to show all the keywords from that. This is basically a summary of
Got
everything
it.
up here. And then like a very interesting thing I put here, I have made it so it can like commit an override. See here how see here how this shows like the severity level of 2. Say I decide that no, it's actually a miscalculation or the chest actually doesn't hurt. I can override it to 4. Say it's actually not that critical, and it will change to that. And then
Interesting.
yeah.
Can you explain one thing to me, Aryan? Like you said, it says triage analysis, right? What exactly does triage mean here? Like three something, right? Because it
No.
says three.
So basically, triage. The definition of triage is that it basically orders things based on like severity. That's its actual definition. That is just going to order based on severity, and that's why I have it here. But in general, like my main AI, that's what it does. It takes all these symptoms and converting them to severity level. It's able to organize them to make it easiest for doctors to understand. Like this guy should go first because his is most severe. It's able to order that, like list it.
Okay, interesting. All right. So how exactly is this being classified as like high alert or low alert? Are you just using the just Gemini for this? was like Grok, my bad.
Yeah, so this is I'm using the API for Grok, and that's been able to like do all the AI calculations for like what level severity should be.
Interesting. Okay. All right. You also have that waiting room assistant there, right?
Yeah,
Can you show me
this
that?
is my like last very important thing. This is basically like um just like a chatbot essentially. Like let's say I want to ask it, I have, or like let's say I have uh thinking of a better example, sure, let's say flesh wound.
To type infection instead, right?
Yeah,
That also works. Same thing. Yeah. No, mind.
yeah. So it says for a small cut, rinse with clean water, apply gentle pressure, and cover with a clean bandage. Seek urgent care if it's deep, bleeding heavily, or showing signs of infection.
Cool. Interesting. So, okay. So you have the helper agent. You're using Grok to get this analysis and stuff.
Yep.
All right. What? Okay, you're using an LLM here, right? So, like, uh, uh, what inaccuracies can pop up in this analysis thing, right? The clinical, what is it? Clinical ESI profile.
Yeah.
Like, where do you think Grok can mess up here?
So, oh wait, can you read Hindi? I want to make sure if you can like check if like
I
the
bet,
language
yeah,
is
I
correct.
can, yeah. I
Yeah.
can read Hindi, yeah.
What?
I can read Hindi, yeah.
Oh, you can't. Okay.
I said.
Oh, you can. Okay. Uh, so I've kind of made it so that once you write something in, you'll have to reload to like change language. But like now you can see that it like is able to change all of these into Hindi. Uh, so I think it does the language part pretty well.
Okay, no, that's fine. I don't
Yeah.
mind the language part.
So
That's
I
not
think
my question, right, Aryan?
yeah. So my main concern I think is it's probably not able to like properly understand the symptoms. There were a few issues earlier. Then I upgraded the AI, and I haven't seen many issues, but they still do exist.
All right. The thing is, like using LLM in these sort of applications, right? You have to be a bit careful because
Yeah,
they have a tendency to do something called hallucinate. Do you know what that is?
yeah.
Can you explain what that is?
So basically, like hallucinating is like kind of like explaining like the wrong thing in detail. Well, that's like the best I could come up with it. Like they basically
Yeah.
able to do the wrong, like they're saying the wrong thing, but they're able to like do so quite detailed.
Yeah, with 100% confidence, right? That's the
Yeah,
thing. Like the LLM, right? It's not trained to give you the correct answer. It's trained to give you the answer that you'll go away like thinking like, yeah, this makes sense, right? The one that'll satisfy you the most. So again, like just because you don't want a doctor always telling you what you want to hear, right? Does that make sense? So
yeah,
like similarly, you don't want this to be like trying to gauge symptoms that like because like it feels like there should be certain symptoms, right? Maybe certain symptoms are just completely useless. They don't mean anything. But maybe you had a slight headache a few days ago. That probably wasn't related to anything. Rather than flagging it as like yes, it's probably unrelated. It'll probably flag it as like I need to make up a reason here because there is a symptom I need to give an answer. Right? Does that make sense?
yeah.
So so that is one thing you have to be careful of here, right? So do you have any like safeguards here to like to check the AI's work?
So like I do have a backup that would like if the AI doesn't work, it'll be able to tell me
No, no,
like
no. That is not what I'm asking. Even if the AI does work, do you have a way to check its work? If it does it work, does its work make sense?
uh no, not really. I mean like the main one would just be to like ask another AI if this is correct.
No, like basic things can be there, right? Remember the clinical rationale thing? You defined like certain like heart rate and stuff, right? Like heart rate is equal to 75, this equal to blood. So you can check against those standards, right? Like obviously if it's like saying it's critical, but the numbers don't add up, then like that's a way to check, right? Maybe you can.
Yeah. I mean, I guess there are a few things. Like there's a also the whole point of the doctor being there is for the override. They're also able to check with it.
Mhm. That's true, but like this should be very rare, right? That physician override should basically be like a very rare thing to have to do, right? It should not be a common thing.
Well,
So
I mean, technically speaking, like a person could be like feeling like small chest pain, but when like someone checks it, then it'll be showing that they're actually like having an almost heart attack or something. Those
yeah,
kind of
exactly, right?
cases.
People describe their, again, that's the thing. People describe their pains very differently. 'Cause,
Yeah.
in the medical field, is like a almost like a sort of meme there, where people say like, oh, yeah, if a farmer says he's in a little pain, that means he's dying. Do not trust his word. Because they reply again. So that's what I'm saying. Like people don't admit exactly how they're feeling, or like if some people also describe what they're feeling very differently, right? Someone who's very sensitive, like even like a slight headache, they might describe as my head was exploding, right? But like,
Yeah.
so you have to be a bit careful there, right? So,
And then the
uh,
other thing is this is like
hmm.
the best free model I could get. Like
Yeah,
the
no, definitely. Okay, just one thing. So, like, how just one last question. Like, what things do you need to work on to improve this?
I think like my overall maybe like improving just at this point I think my like it would be pretty easy to input in. The hardest part would probably be like the AI itself. Like I think it probably shouldn't put a chest hurting as ESI2. It's like debatable, right?
Hmm.
So I could maybe add something to like say that it's somewhere between 2 or 3, and then there's just the idea of improving the AI because like in symptoms itself, it's probably not as strong as it should be.
Cool. Yeah. So add some uncertainty in there, and also one thing you can do here, right, is that like ask follow up questions, right? Think about like what doctors actually do, right? Like especially nurses and stuff, when they ask you for your symptoms, they're trying to get an analysis. There's tons of questions, right? Here, you're just asking them to describe everything, right? So this is a very psychological thing. Whereas if you ask someone a question like, for example, if I ask you to list all the movies you have seen, that's a very difficult question for you, right? But if
Yeah,
I ask you specifically, like, okay, have you seen the Terminator? Right? That is a very yes and no question you can answer very easily. Even if it's a one movie you watched like 10 years ago, you will still remember that. Get that?
yeah,
So like that's the thing. So uh, two things to work on, right? Add a bit of uncertainty and some safeguards here. And second thing, make this like almost like a questionnaire, right? It should be a back and forth conversation almost for a while. And once it's reached the threshold where it's like, okay, I'm pretty sure I have all the information I need, only then will it give an analysis. Does that make sense?
yeah. I mean, that's kind of what my chatbot is for. Like, but it doesn't take the initiative, but like you can say,
Hmm.
this might be happening. How could it be related?
Yeah, exactly. Right now, again, before it's the same thing as measure twice, cut once, right? So like get as many get as much information from the patient as possible. Only then write the report, right? All right.
Yeah.
That's basically it from for me on the technical side. This is a very interesting project, Aryan.
Thank you.
Actually, it's very practical, very useful as well, right? So this will go very well in your portfolio. So, anyways, that was the technical side. Now we'll move on to the uh, more of the other stuff as well. So that'll be it for me. Just stay in the call for a few seconds. Someone will join you soon. Okay.
Okay. Wait, I had a few other features that I was gonna mention. Just mainly like I could like change the theme here. Like
That's
if a
interesting.
person was hit with like like something that hurt their eyes, and then in case it was necessary, I had a print feature here. Actually, I'm not
To
sure.
get a PDF and stuff.
Yeah, like in
All
case a
right.
doctor needs it on paper, and then I have this which would like output it out.
Intake parameters integrated successfully into local records.
Could you hear that?
I did hear that. That was very cool. All right. Okay, Aryan, but I do need to go now. Just
Okay.
wait in the call for a few seconds. Okay. This is really cool.
Okay. Thank you.